Dr. Josef. I am so excited you're here today.
It's my pleasure to be here.
Okay, so this is going to be so juicy, this discussion. So I really want to dive right in. The first thing I would love to hear from you on, I've seen lots of content from you around this, is what actually helps people combat a potential mental illness diagnosis down the road.
So I think that most mental health problems, I can't believe this is controversial, are not due to chemical imbalances or anything wrong with people's brains. I would put them into, I think there's 4 categories of things that I routinely see cause mental health problems. So it would be relationship problems, things like social isolation, but also conflicts with your partner, a lack of purpose. That could be a career or finding meaning. I think we have just health problems are a massive issue as well. And particularly just the quality of the food that we're eating, things like insulin resistance, the fact that our brains become starved of actual nutrients and energy sources that we need to function well. And then finally, it's drugs. And this is the part where people always hate me, because I actually think that drugs I'm not just talking about cannabis and alcohol. I also think that the overuse of stimulants, like things like caffeine, things like nicotine products, when you go too far with those, I also see them acting like drugs. And so those are the 4 main categories that people really need to work on if they want to optimize their mental health.
So what happens when you say this to people? Because it is controversial, which is crazy. So why do you think this is so controversial when you say to somebody, well, it sounds like you actually need to work on, this and this, versus you don't need to go on a medication, or potentially that diagnosis isn't accurate? How do people respond to that normally?
So some people, they're like, thank you, they'll be very willing, but I actually get a lot of negative responses from people. And I think it's because there's been just I'm going to put my tin hat on now and say there's been a mass sort of brainwashing going on in a way when it comes to mental health problems. There's certain perspectives on mental health and medications that have been platformed in a very conscious way by groups of powerful people, whether it's the pharmaceutical industry or the American Psychiatric Association or big patient groups, to promote a certain way of looking at it. And one way of looking at this problem is that, depression isn't just being sad. People have heard that before. This is a serious medical condition. And if you were to suggest that, you can just, hang out with your friends or, change your diet and that would fix it, you're clearly someone who has lost the plot. You really are quite an insensitive person. You don't appreciate the complexity and the severity of mental illness, and you're really just stigmatizing people. And how dare you? How dare you suggest that, this is something that I could pull myself out of? And so people can get actually really hostile. And yeah, big time. And there's this weird, and I'm sorry for your audience if I don't try and be political, but sometimes I just have to talk about it because this is what I see. I feel like I feel like there is like a coalition of people, generally in left-leaning media spaces, where they are, we are pro mental health, we are pro like anti-stigma. And anytime anyone says that the mental health problems are anything but, biological, and anytime anyone criticizes the medications, you are stigmatizing my base. You are being harmful. You are being anti-science. You're like a vaccine denier or something like that. And you just have out-of-date views. And so there just seems to be this block, this coalition of people who have these really strong views about it, and they absolutely hate it when people come along and say, we need to be way more critical about how we're looking at these drugs, and we need to talk about mental illness in, frankly, a more accurate and more empowering and helpful way for patients.
Yeah, I agree with you. It's really hard. There's such a narrative out there. Like, even when I want to talk openly about it from my perspective, I always have this moment of hesitancy, because there's going to be so many people who think I'm completely invalidating their experience and somehow offering alternative recommendations or informations or a different perspective somehow completely denies their experience or that they're very
Hmm.
ill, right? And it's really hard then to get the information out there at
Correct.
times, right? Without being okay to be that person. And I think it's amazing that
Hmm.
you're doing that. I was devouring a bunch of your YouTube videos and I'm like, "Oh my gosh, this he's so spot on." And I wish more professionals were speaking about this openly. And there definitely is a movement happening, which is really exciting. But that's the other piece of it is that if you're not a professional, right, or you don't have some sort of degree, very specific degree or certification, if you speak openly about your experience or things that you've come across automatically disqualifies you as well. So it can be hard. It's so I'm so happy that somebody like you with your credentials doing what you do is very publicly speaking about this and
Yeah, and
educating
people are
people.
waking up to this, which has been really exciting, both on the right and the left. I mean, NPR had a nice piece recently on antidepressant withdrawal, which I was really excited to see. They're seeing one of like the darkest things that can really happen with I guess the PR of a pharmaceutical company is they can people will hear things like these mental illness is serious, and like we talked about, like, don't question this, and they'll say to themselves, this is coming from grassroots, this is coming from people who are suffering and who are saying, hey, this is, I tried a million things and nothing helped. This is coming from doctors, this is coming from government. It's not. This is coming from the pharmaceutical industry. This is coming from a group with billions of dollars where they can selectively pick which perspectives they want to platform. They go, okay, Dr. Josef's saying this stuff. We're going to censor him. This doctor is too middle of the line. Oh, but we have this doctor over here who's like, anyone who says anything bad is stigmatizing people, blah, 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 blah. And they just like fund the hell out of him. And it really just shapes the public discourse. And so there's lots of doctors and patients out there just being like, well, I hear this in the news, I see this on TV, I see this on social media. This must be the right perspective to have. This has to be the one to have. But they don't realize that it's been so constructed. And you're right, there is a movement because all of a sudden people are waking up and they're like, wow, all of these groups that are saying these things, they're all getting money from the pharmaceutical industry. And actually, maybe we need a much more balanced look. We need people to criticize the way we're using these drugs and the overuse of them, and we can't just kind of shut everything down.
Yeah, absolutely. Something that I mean, I practiced as a therapist. I was licensed for 15, I practiced for 13, and I saw a lot of these types of things behind the scenes. I also went through the mental health system as an adolescent. And some of the things that I've even learned through all of this, I had no clue as a professional. And looking at these studies more closely, how they've only, a lot of these medications have only been tested for a couple of weeks and then they're being used for years and years and years. It's really about people understanding how to gain perspective, like zoom out a little bit and look at multiple pieces of information. And it seems like people are taught there's this one piece of information, that's what you need
Mm,
to go on. And you start to zoom out and look at everything. There's a lot of backlash on that, right? And it's one of my biggest things about this podcast is teaching people how to ask questions and think for
uh-huh.
themselves because, that is something that is really poo-pooed when you're in the doctor's
Well,
office, to be really honest. Most practitioners don't want you to ask a lot of questions. They don't want you to be doing your own research. They don't like it. They don't know how to answer a lot of those
mhm.
questions, and it's intimidating. It's really overwhelming for people. I'm curious your thoughts around that, like how people can advocate for themselves even though they're up against this
Sure,
backlash, if
yeah.
you will.
I think, I mean, you hear things so often that they like it's almost like the frequency of which because you hear something so much, you start to believe it's true, even if you don't question it. And so again, like the chemical imbalance myth, like you could go in and see a doctor and they're like, well, you actually have major depressive disorder because you have 5 out of 9 of these symptoms. And, there's, we don't really know why this happens, but there's probably a genetic thing and you can take a drug. I mean, we've been hit over the head with that stick for the last 30 years that you don't really question it. But if you had never been exposed to that propaganda, you would have said something like, "Are you crazy? Like, you've literally spent, like, 20 minutes with me, and you don't know anything about my life. You don't know anything about my health, my relationships, my spirituality, where I get my meaning from. And you're going to tell me that all of these, my mental health problems can be fixed with just a pill." It's almost like a reverse education. You have to red pill yourself and just be like, hang on a second. All of this, is really constructed in a way to support the prescribing of medications and the efficient processing of patients through a healthcare system that is essentially just billing insurance. It's optimized for just like billing insurance. Like if I can see 4 people in an hour, that makes me more money. It makes the private equity more money. It makes the hospital more money. And it doesn't actually help the patient. And it's such a frightening thing when you grow up in this world where you're like, I have to trust doctors, I have to trust hospitals. I want to trust these institutions, and the white coats and all of that. But it's become so corrupted lately that it's like it's painful to realize that. You don't want to realize it, because if you realize it, you have to start questioning everything, and you start to feel lost.
Yeah, you do. You do start to feel lost. I've been through that phase of this whole journey. I always encourage people, you can always, especially if you're in the office. So I've had experiences where, I mean, I don't know, I was probably in my early 20s. And looking back now, I think I was having potentially like an
Hmm.
Epstein-Barr flare, but I didn't know it at the time. I was really tired and really fatigued, and I was going through my last, like, year or 2 of college. I'm a high achiever, and I went and saw a doctor and explained, everything, and within 5 minutes, he kinda stopped me, and he leaned in, and he said, "Are you ready to go on antidepressants?" And I was just like, "I'm pretty sure that's not what like, I'm not depressed. I might feel low, I might feel, but I know I'm not clinically depressed." And, I didn't know what to do in that moment. I got up and very politely left, but that took so much guts, and I sat in my car and I cried for like 20 minutes because I just felt almost like cornered in a way, because this person's supposed to be like an authority, right? Or an expert. And I have a lot of guts and wherewithal, and a lot of people they don't know what to do. They don't know how to respond. It's like intuitively they know that's not the right answer, but they don't know what the actual answer is, and this person's supposed to
And
help
there's so
them.
much bundled in there, right? Like, I don't know if this you felt this way at the time, but I've had many patients tell me that when the prescription for the pill comes, it's also this change in identity, because sometimes the doctors will say, you probably have a genetic condition or a brain condition. For many people, it's long lasting. I mean, talk about a disempowering thing. It's like your brain is broken and you have to take this pill, and you might have to take it on an ongoing basis. It's like, I'm broken, something's wrong with me. It's such a disempowering place to find yourself in. And I've had many patients tell me that they would cry. They would hear this news and they would just say, It's hopeless."
Yeah, I mean, there's a lot of so what led me to walk away from practicing therapy is the last several years, and I heard it the whole time, but there was something about the last several years I was going through my own shift around how I wanted to serve people and my knowledge around mental health and overall wellness. And so many women would sit on my couch, and especially postpartum women, and we would talk about their journey. And I would say, "Well, have you spoken with your, OBGYN about this?" And a lot of them would say, "I don't want to tell them because I don't want them to tell me I have to go on medication." Like, they intuitively knew that that wasn't the answer, but they knew that that was the answer they were going to receive. And so a lot of them felt like there was not, like, they were just stuck. They were stuck because they didn't know how to bounce back with their mental health, and they didn't want to do it via a pill, or they didn't think the pill would work, or they'd been on it before and it didn't work, or whatever it was, right? And it leaves people, like you said, feeling overwhelmed and confused and not really knowing where to turn. And then on the flip side, we've got all of this information at our fingertips for how to be healthy and how to be well. And it's like 50 million potential steps that you have to do to be this healthy person. So we're being inundated this way as
Mm,
well. And I'm curious, how do you help people just dial it down?
yes.
Because like you said, there are these 4 fundamental things. So when you're speaking with somebody and maybe they're tapering or, maybe they want to prevent, they don't want to have to ever go back on a medication. How do you help them just really narrow it down to get to really good at the
Sure.
fundamentals
Yeah.
first?
So it's like triaging, imagine there's like a mass casualty and you kind of have to pick somewhere to start. And so you have to get sort of centered and then you look at your life and for instance, am I in like a very abusive relationship? Yeah. If that is the case, that might be the number one priority that you need to address. And you would look at that. Another thing is, am I not looking after my health? So I always like health as a very easy way to ease into this, especially when people are, maybe there's some stuff going on in their relationship, maybe there's some dissatisfaction in work. But if you're also physically unhealthy and maybe overusing some kind of, drugs and things like that, I often find that just focusing on health can make other issues less problematic. So unless there's some big catastrophe in the other area, I just say, okay, step one, let's see if we can just get you on, make sure you're nourished. You're nourished right with the right kinds of foods. Let's have a look at your sleep. Let's see if there's anything that we can do to get you sleeping better. Are you overusing any
Mhm.
drugs or anything like that? Let's kind of bring that down. Let's lower the anxiety. If it's stimulants, that'll also help you sleep and stay calm. It's a really easy beachhead to just get into and just say, okay, so now we've got you a little bit healthier. What's the next biggest thing going on? And people will say things like, I'm lonely. I don't know how to meet someone, or I'm having this problem in my relationship. Now, the trick with this is, you're right. There's a million things out there, and this is where people need to find the right coach or guide to help them, because you know fixing loneliness or having a satisfying relationship is it's incredibly complicated, and you need to have someone that can break down this big complicated issue into smaller little pieces. And so that would be, like working with someone like yourself. You say, we're going to work on your relationships. If it's something like, lack of purpose, difficulty at work, again, you might not even see a therapist. You might see a career coach. You need to find the right person where you can talk to them, and then they can take this big, scary problem that you're having and show you that it's actually not that scary. And that if you just can do steps 1, 2, and 3, you'll make it through. So there isn't like a universal kind of, this is the protocol to do it. I think about it as triage. I always like to do health first, and then you just kind of get to work with the other things and hack away at it. And you have to have a lot of grace, because satisfying relationships and finding meaning in your life, these are things that people cultivate over decades. It's not something that you can just like turn around. I mean, it's so much work and reflection and effort to do those things. And I guess that's why it's so tempting to think, there's a pill, there's a pill that's going to get rid of all of these bad feelings that I'm having because these other areas in my life are out of order. That's why it's so seductive. But there's no shortcut for this. How could there ever be for the most complicated things that we do as humans? There's not going to be a shortcut for it.
Yeah. It's really interesting because my husband, he will very easily say yes to a lot of things and then he'll be overextended. And the first thing to go is like his sleep and his nutrition and his own self, like his time with himself in the morning and his hobbies and things like that. And when that happens, his mental health starts to tank. He's more anxious. He already isn't sleeping enough, then he can't sleep well when he does. He's irritable, right? He's impatient. He's not really present. It's been interesting because he's been on his own journey with some healing and figuring that out. And now he's prioritizing his sleep. He's prioritizing his alone time in the morning before he goes to his job and, shows up for our family. And he's almost like a completely different person just from prioritizing his sleep, prioritizing some alone time, and getting his nutrition under control. Just those very things that we think are not sexy, not fun, like
Yeah.
very whatever. Those 3 things He's a completely
Yeah.
different person.
And
It's
I have my
crazy.
own story about this as someone that was a big
Yeah.
insomniac at certain times. And also
Mhm.
growing this business, so where we take people off medications. I could not turn off my mind at night. I was always worried about work. First thing in the morning, I would wake up at 4 a.m. in the morning, couldn't go back to sleep. Felt like I had to keep on working because otherwise everything would fall apart. And this obsession with work and succeeding in this endeavor, it was costing me my sleep. It was making me not present with my family and with my wife. I was missing my daughter growing up. My wife was feeling alone raising my daughter, and I had to do my own inner work. I had to figure out why is it that I'm so obsessed with work to a fault. And it all comes back to these stories that we tell ourselves. And I know for me, one of the stories was, if you're not constantly working towards something, it's always going to fall apart. And if it falls apart, you are a failure. And so it even comes back to like a self-esteem thing. It's like, I need to do this. I need to be successful to feel like good enough. And believe me, I used to take Xanax. It's a hell of a lot easier to want to take Xanax and numb yourself out to the fact that, you know, you can't lay your head down at night without having all of these anxious thoughts. Gosh, is that tempting? But it makes you worse. And so you kind of have to do the work. There's like, whether it's anxiety or insomnia or depression, you have to, and it sounds so gay to be like, oh, I'm going to have to sit here and like journal and like work through these difficult thoughts. I mean, that's how I used to talk to myself. This is just stupid. I used to go to walk and I need to sit here journaling because I have insomnia. And so even just the way I would talk to myself about it, but it's like, unless you go through these things, you never really find the sustainable way. And I can sleep now. I have a better relationship with my family. I have better boundaries around work. But I don't know. We don't emphasize, looking at simple things. So when you share that story about your husband, I'm just like, I can totally see myself there. And I think this is so universal for so many people out there. They're going through these similar struggles, and we don't honor that. We just drug, and we're so primed by the media to be like, okay, that's a sensible, modern way, enlightened way to deal with this brain condition.
Well, in my opinion, so much of it has to do with this need to perform all the time. I've had my own, stuff that I've had to work through. I'm an entrepreneur. I have a huge business, and I have had my own periods of time where I'm like obsessed with success and hitting certain numbers and impacting a certain amount of people. And then what goes out the window? It's my taking care of myself, my own time for exercise, having bouts of insomnia as well. Like, and I think that it's not all this, but I think it's really it's weird because we make mental health diagnoses like this serious thing. But then we don't take how we take care of ourselves seriously. It's like we override it with this need to perform. And it really doesn't make sense if it's so serious. If our mental health diagnoses, maybe that somebody receives, is so serious, but then we think a pill's gonna fix it, but we continue to override taking care, just like if you had diabetes, and I don't think mental health diagnoses and things like diabetes are the same. But in the sense of, if you had diabetes and you start taking insulin, you would still need to make lifestyle
Hmm.
changes, right? And people don't look at mental health the same way as a lot of like physical diagnoses. They don't look at it as, I need to make some lifestyle changes to take care of my mental health. And it's so weird to me. I don't know how we went down that
Hmm.
path, but we did. And I really think that the pressure that is put upon us for producing and making money and keeping up with the Joneses really completely screws with us as human
Hmm.
beings. And it's a huge overarching reason why we go down these paths of self neglect in the first place.
And that's another issue that I have with this. I mean, the idea of blaming mental health problems on people's brains, I mean, it also is politically a very easy way to deal with a lot of real problems that we're going through in the world. I mean, we have economic problems. People can't buy homes. We have most families these days have both parents working and they're looking after kids. I mean, it's so stressful. You know, when you work and you have kids, you're not going to be able to look after your health. If the groceries are really expensive, it's hard to get great quality food or even find the time to cook good quality food. Rather than looking at how we've just let what is happening with capitalism and the economy right now and the stresses that it's putting on families and people, we don't actually have to look at that as a society and say, you know, is this really the way we want to gear things? And I'm not a big lefty or a socialist or anything like that, but I think we need to look at these issues because they are making people unhappy. But you don't need to if you just say, you know, mental health is on the rise,
Mhm.
chemical imbalance, nothing to see here. Let's just keep on going.
Okay, so let's talk about chemical imbalance. Let's talk about that
Hmm.
narrative. I heard that when I was 15. Your daughter has like right in front, your the chemical imbalance. And looking back, I'm like, okay, I definitely didn't have a chemical imbalance. I was responding to my environment. And I was 15 and hormonal, but very much my mom was like, oh my gosh, okay, like we need to fix this. Yes, we will put her on this medication, whatever you say. And I'm wondering if you could talk a little bit about the chemical imbalance theory and how it's been disproven and just your opinion on that and your
Sure. Yeah.
thoughts on that.
So the chemical imbalance theory is the idea that mental health problems, and let's use depression, for example, are caused by deficits in like serotonin or other neurotransmitters. And so it emerged in the 50s when scientists found that if they gave a patients drugs that increased things like serotonin, they would look less depressed. And so they, using reverse reasoning, they said, well, maybe they were depressed because they had low serotonin because this drug increases serotonin. And yeah, I guess there is some logic to that. You know, another way of looking at it could just be this drug is having a drug effect. And yes, you know, it's causing some changes in serotonin. And that's just, you know, just like alcohol can cause some mood changes or methamphetamine can cause some mood changes. Maybe we're just layering a drug effect on top of, you know, someone that has, you know, low mood or depression. And to me that would have been more logical, but the thing is there was an incentive to promote this idea that depression was due to a deficit in serotonin because it's easier to sell drugs that way. So pharmaceutical companies, the American Psychiatric Association, anyone who had an interest in the promotion of drugs as treatment, they just kind of sprinkled fertilizer on that myth and it took off like crazy. And the reason it's so powerful is, you know, if you believe you know there's something wrong with your brain and there's a deficit in serotonin and there's a drug out there that boosts serotonin, you just say, well, I'm just going to take the drug that boosts serotonin, you know, case closed, let me sort of dust my hands. It's like fixing type 1 diabetes with insulin and I can just go along with my life. It's very easy to persuade people to take the drugs. But the other vista, which is the other way of looking at it is if you just acknowledge that it is a drug with a drug effect, it makes people really uncomfortable because all of a sudden you're using drugs to mask symptoms that someone's having. And your grandma could tell you that a good strategy for fixing things is never to just sweep it under the rug and mask it and hide it with something else, because obviously the problems don't get better and they fester. And then, you know, when you also look at these drugs as drugs, you start to say, well, maybe they have some characteristics like other drugs. Maybe you develop tolerance to them. Maybe you develop long term toxicities because the brain is not designed to be in a drug state for long periods of time. And so we have done, you know, big psychiatry and big pharma has done everything they possibly can to say it's a chemical imbalance or some variation. Sometimes they're talking about different things like, oh, it's BDNF or some other chemical, trying to reduce it down to this thing that the drug fixes because they want to hide from the American public and people out there that essentially we're just drugging people's moods away. And the thing, you know, I want to add something here. I'm saying a lot of very negative things about these medications, but I don't actually believe that that they should be banned or made illegal or anything like that. There's nothing wrong with the drug. People just need informed consent. And gosh, they need to. You would only ever take a solution like this when you had tried everything else. And so I want to say sometimes that gets lost in this message. But this is also not me bending the knee to this. I really believe that Like 95% of people should not be on psychiatric medications because they're a bad long-term option for them, and there were safer non-drug options available. And we should only be reserving, essentially the drugging away of symptoms for people when everything else has failed.
Yes. Yes. Regards to the chemical imbalance theory, is there actually any evidence that
No.
supports that?
So researchers have looked at this again and again. And the way they usually do it is you get a group of people who are diagnosed as depressed and a group of normals, and you can do different tests. Now, the tests that they've done are things like they will draw cerebral spinal fluid, which is the clear liquid that floats around the brain, and then they will look for metabolites of different neurotransmitters. And what they find between the two groups is there's no difference. They'll do brain scans, functional brain scans, where they can see different parts of the brain light up. They don't find any differences between depressed and non-depressed people. They do autopsies on people who have been very depressed and take their lives, and they stain the receptors in the brain, and they look to see if there's any changes in the receptors between the depressed people and the brain tissue of the non-depressed people. They find no differences. So every single time they've done this, they have not found a biological way to distinguish people who are quote unquote diagnosed with depression from normals. And that is why we never use any biological tests in psychiatry. We're not doing brain scans. We're not doing blood tests. It's not because it's inconvenient or, it's too expensive or anything like that. It's because scientifically it just doesn't work. And so because we can't find any way to distinguish depressed people on a biological level, how could it ever make sense that we have a drug that could fix that? We don't even know what's causing it biologically.
Right. So, can we talk a little bit about how psychiatric medications work then? Because I think people don't understand. A lot of people think that it is bridging a gap that's there. So, how do they
They
actually
work
work?
just like they have a drug effect. And so antidepressants, whether you're depressed or not depressed, they generally do three things. If they're more serotonergic, they have a numbing effect. And this can be experienced as very therapeutic for people who are very anxious. People will even say it's life-saving at times to have their emotional range sort of constricted and to not worry so much. Some antidepressants like Wellbutrin are energizing. Others like mirtazapine have a sedative effect on top of the numbing effect, and so they can help with sleep as well. Antipsychotic medications are also extremely numbing and emotionally constricting. They make people less worried about paranoid thoughts that they're having. And so these drugs, they work by disturbing the neurotransmitter functioning in the brain and inducing a drug effect, which, at least in the short term, for many people is experienced as therapeutic. The problem with this is long-term solutions, though, is that people simply just become tolerant to the
Yeah.
drug. And then, 6 months, 12 months later, they say, well, I'm not really feeling the effect as much. And they go up on the dose. And then a couple of years later, they're maxed out. And instead of the doctors simply recognizing that they've become tolerant to a drug, because obviously that's what happens. That happens with all other drugs. The doctors won't say that. They'll then tell them that they have a treatment-resistant depression or their mental illness is evolving, and now you need two big guns instead of one, and they'll add on another drug to continue to mask it. And then you end up in a situation where people are on 3 to 5 different drugs, which unfortunately isn't that uncommon.
Yeah, and there's so many things that people experience from being on these drugs long term that they don't even realize are an effect of these drugs. So, can we talk a little bit about medicating children for a
Yeah.
second and what this might do to a child's brains, system, hormone, like anything, right? If they're being medicated maybe with a stimulant or even an antidepressant or anti-anxiety, right, an SSRI early on, how is this affecting their development and their brain and their ability to, cope later on as an
Yeah.
adult?
Let me break this in half because I want to talk about the effect of exposing a developing brain to chemicals first and some of that data. And then I want to touch on the psychological impact of being a young child and taking a medication and being told there's something wrong with you. So let's start even before birth. So what we've found is that when women take antidepressants, the children who are exposed to them in utero, they actually have changes in their brain. So all antidepressants cross the placenta. And we have 12 MRI studies showing that there are clear changes between the brains of the kids exposed and not exposed. And this is controlled for depression. They look at all the variables. The explaining factor is essentially the exposure to antidepressants in utero. Now, when we looked at there's been systematic reviews of animal studies where they get two groups of like rodents, and they'll expose one to antidepressants and another not to. We have to do these in animal studies. It's very hard. You can't do that randomly in humans. But what happens to these mice when they grow up is there's a higher rate of autistic-like behavior, and there's a decreased interest in sexual activity. There was one case control study where they did look at adolescent humans who were exposed in utero, and they compared their brains to kids who weren't exposed as babies. And they actually find changes in amygdala signaling. This is the section of the brain that deals with fear and anxiety processing. And they found that those changes in signaling, they were correlated with worse mental health outcomes. And so from strictly just a developmental impact, like exposing kids either in utero or when they're in this very sensitive part of their life where their brains are really growing and developing, that can have an impact on anxiety and depression, mood, and even sexual interest. And so I think that is concerning. Now let's talk about SSRIs in youth. So antidepressants, they cause sexual dysfunction in, I'd say, up to 70% of people who take them. If you have a kid that gets on this, before puberty, 10 years old, and then they go through their adolescence with a lot of decreased libido, sexual dysfunction, that is also going to be essentially taking out this very core experience where you're really finding yourself and your sexuality and your attraction to others. And that can lead to confusion. And I've had people tell me after they developed sexual dysfunction that heterosexual men started questioning their sexuality. There's an increase in people identifying as asexual. And I do believe that blocking sex drive with these drugs during this critical period of their life has an impact. People don't understand how powerful these drugs are. I mean, we give SSRIs to sexual predators. I mean, this is something that is done. Like, courts have ordered people who have these conditions to go on SSRIs to diminish their sexual drive, to reduce recidivism. And so these are really potent in that way. Oh, yeah.
Yeah. That's so interesting.
It's
giving them to other.
Yeah.
That's crazy to me.
It is. And Chat GPT, because I know some of this stuff sounds crazy, but this is happening all the time.
This is sound crazy to me, but it does sound crazy sometimes to someone who's first coming across this information, right? But I think it's so important. Wow. Okay. So that makes a lot of sense.
The other thing that's an interesting thread to pull on is that SSRIs, not in the US because it was bad for marketing here, but in other countries around the world, have marketing indications for premature ejaculation. And so they're actually marketed to decrease sexual functioning for some people. That's how potent the effect is. Now, the last thing that I want to say about this from like a developmental point of view is it has to touch on ADHD and Adderall. We live in the US, very competitive society. I mean, there are places where, I think of the immigrant families out there who are really known for hustling and putting a lot of pressure on their kids. They're just like, you got to be a doctor, you got to be a lawyer. And, we have kids who feel all of this scholastic pressure, who end up taking Adderall kind of as this performance enhancing drug that is meant to help them sit still and find subjects that they're genuinely not interested in more interesting. And the consequence of this long term is if you drug a child into being interested in something that they're not naturally interested in, they go on to get into a career later on that they need to be on drugs to do. I spoke to Cooper Davies recently from Inner Compass, who was put on a whole bunch of ADHD medications and different psych meds so he could succeed academically, ended up becoming a journalist. The medication side effects caught up with him. He realized he didn't want to be drugged anymore. He came off the medications, realized that he hated his job and he didn't want to do it. And he had to start again in his because he felt the pressure to essentially drug himself to do a job that was acceptable from society. So I think we've just become so lost in this rat race to have our kids perform and do things that we forget the first step, which is help your child find their passion, help them find something that naturally energizes them, and then just let them do that for 10 to 15 years. They will be able to perform at that at a very high level without being on drugs if they find something that energizes them. And we need to stop this kind of square peg in a round hole mentality where if it doesn't quite fit what we want, we're just going to sort of drug it into shape.
Well, it's not only that. When I worked as a therapist, I worked a ton in pediatrics. And there's a lot of pressure that happens where, if parents are getting emails, like I would have parents come to me and say, I keep getting emails from the teacher that my child can't sit still, and it would these parents would be so stressed and almost feel like the shame that they're and I would try to like developmentally your child shouldn't be able to sit still for 6 hours. Or and that's a piece that I think is really huge too, is we've really gotten out of touch with what's developmentally appropriate at different ages, with how classrooms are constructed and run. And how, I mean, my daughter was in 5th grade, didn't she had a 20-minute recess. I used to have 2 30-minute recesses, when I was in grade school, and now she doesn't even have that. She is in a very rigorous academic setting, but I've always told her, like, do you try your best? Right? And if you know it's your best and that's all that matters, it's not, what grade you receive necessarily. It's more about, what your best is. And also, I've never subscribed to her needing to sit still perfectly and things like that. But again, I have that education. I have that like, you know, very strong orientation around that. Whereas a lot of parents are just like, oh my gosh, my kid is bad, or the teacher's upset, or they need to be compliant. They don't always know, right? They don't have the wherewithal. They're overwhelmed, and then they feel ashamed that their child can't sit through kindergarten for 6 hours or whatever it is. And there have been teachers who, with previous clients, who have told them, "Hey, have you considered taking your child to be evaluated for ADD? Have you considered putting your child on a little bit of a medication?" And I'm just like, your teacher should never be saying anything like that to you. And so it's so just normal. It's so normalized for this to be just like, hey, if your kid can't sit still, if they can't fully control themselves, their impulses to touch their friends or, whack somebody, then there's something wrong. Like, you need to have them
Yes.
evaluated. That's like the first answer all
Yeah.
the time. It's
Again, another one
crazy.
of these societal issues that we should be grappling with together and talking about how are we going to do schooling? How are we going to set it up so it works for more families and not just the kids who come out who can sit behind a desk and who are very interested in in the subject matter. Because yeah, right now moms are being pressured to drug their kids into compliance because it's a guilt trip. It's like my kid's bad. And so I'm a negligent parent because I'm not taking them to see the psychiatrist. And how does that reflect on me? There should be more options than just drugging the child into submission in the classroom.
Yes, absolutely. So I know you wanted to touch on hearing the diagnosis, being put on a medication, and how that affects a young person. And I'm very interested in your perspective because I know how it affected me.
Yeah.
And so I really am curious to hear what you have to say
Yeah.
about that.
And it's not just young people, it's older people as well. There's some foofy like stuff from the coaching world where it's just like whatever you focus on expands. But I really believe that. And so if you tell someone that you're broken and there's something wrong with your brain and you need a drug for it, and if you focus on that narrative that, this is who I am and I have my limitations and I need to be on the meds, that will expand in your life. I know that sounds maybe a bit mystical for someone who's meant to be scientific, but if you feed them a different narrative, yeah,
Hundreds of thousands of people.
yeah,
It's very
yeah.
accurate. Yeah.
But the converse is like there's nothing wrong with you, and you can, this is something that we can work on. This is something that we can work on together and fix. You're not broken. And we can find a place for you in this world, even if it isn't excelling in math and writing, English stories, we will be able to find something that is a really good fit for you. Uh, and sometimes it can be hard. It's like, well, makes sense that you're depressed because you're socially isolated. Makes sense that you're socially isolated because you had a traumatic upbringing and you generally tend to perceive other people as threatening. Hey, this is a lot of work, but this isn't impossible. And if you just start here with me, we can work on it together. And, it's not going to happen overnight. But, if you stay with me, we'll be able to take it step by step and we'll be able to get you into a place where those mutually satisfying relationships will start to happen. It's not sugarcoating it. It's not making people think that it's going to be easy. It's that it's a lot of hard work, but you can do it. And again, like that thing about your focus, if you focus on that, that will expand that empowering narrative where you actually can fix things in your life without drugs it will become this self-fulfilling prophecy where you're just on a much better trajectory from a mental standpoint, not a disempowering one where you're just
Yeah,
broken.
absolutely.
The solution to your problem is to find the next drug that you see advertised to you on TV. Maybe that one is going to be the right neurochemical to fix my problems. The solution is contingent on the pharmaceutical company rather than all of the things that you can do and all of the help that you can get from knowledgeable, supportive people out there.
Yeah, and there's so much power in just changing your environment and making different, micro changes in your world, whether that's um, certain relationships, your career, your nutrition, your sleep habits, your hobbies, what you say yes to in your life. I mean, it's very powerful. It can cause an incredible ripple effect in your life that medication really never can. And I am curious, how can we talk a little bit about the process of when somebody comes to you and they've been on medication and they're ready to get off, and what that looks like, tapering, I don't would you call them side effects of tapering or
Sure.
effects
Yeah.
of tapering? What people are dealing with, what does that look like?
And so we prepare people for the taper when they come to us. We assess their sleep, we look at their diet, we optimize those issues. We generally don't bring people into our program if their life is in turmoil, right? If they're in the midst of a divorce or something like that, we're going to say, hold off. Let's wait until there's a bit more stability in the context of your life before doing this. And so most people come to us with fairly, their lives are okay. There's not some acute crisis going on. Optimize sleep, optimize diet. And then if I were to break down the tapering process just in a simple way, what we do is usually a 5 to 10% reduction. And then we wait about 4 weeks and then we adjust from there. Did they handle it really well? We might speed up. What did it push them a little bit? We might slow down. And then we simply just track them on a month to month basis as they come down, modifying the speed. The thing that is a bit unique about tapering is that when you get to the very low doses of the drug, people tend to start to experience withdrawal. And this is really important for anyone to understand who's coming off a med, who's been on it for years. When you're at the higher doses, I want you to imagine there's two neurons kind of interfacing. The drug sits between the two neurons and it controls how the signaling happens. At the higher doses, there is such an excess of drug in there that you can remove quite a lot of that drug and you don't actually disconnect the drug from the receptors that much because there's so much excess to just take the place. But when you get down to the very low dose of the drug, all of a sudden you might remove, 5 milligrams, and you'd been removing, 10, 15 before, no problem. But at that low dose, you remove 5. There's not a reserve anymore because you've lowered it so much. All of a sudden it will disconnect a lot of the receptors and people will kind of go into withdrawal and they'll panic. They'll go to the doctor and the doctor will say, see, you have a broken brain. You need to be on this drug. You tried it and you failed. And then they end up being on an unwanted drug for the rest of their life. And so what I tell people to do is to not panic. When you get to those lower dose ranges, it's really normal for you to experience withdrawal. Take the drug that you have left over and turn it into a liquid. Why do I say that? Well, if you take, let's say it's 5 milligrams of Lexapro and you turn it into a 1 milliliter solution. You can then draw it up in a syringe. That syringe will have 100 little lines on the side of it. And you have so much precision to just lower down that last remaining amount of the drug in a way that your brain is going to be able to adapt to. And so what I like to do in
Mhm.
my practice is I like to taper people with, mild to moderate withdrawal symptoms anytime they get to the place where it's impacting their life or their ability to function. We slow it down. Um, it's a much safer way of tapering. And generally, it takes people about, people who are very sensitive to withdrawal. And that's not everyone, but it's most of the people I see. Those people who are sensitive to withdrawal, that can take between 1 to 2 years to get them off a drug if they've been on it for several years or decades. And so don't rush, just go slow. Like the Navy SEALs say, or the Marines, what is it? Now I'm going to butcher it. I think it's slow is smooth and smooth is fast or something like that. But, it's like just take it easy.
Well, in my coaching, it's you
Yeah.
slow down to speed up, right? You slow down the results you're looking for. Are there certain medications that create more intense withdrawal, or is it kind of across the board the same? Is the amount of time you've been on a medication really important when it comes to withdrawal? Like, are there patterns you've seen, or is it kind of just case by case?
So the worst drugs for withdrawal, SSRIs like Lexapro, Zoloft, Prozac, SNRIs, things like venlafaxine and Cymbalta. Mirtazapine is really bad. All of the benzodiazepines, Xanax, Klonopin, Valium, and the Z drugs like Ambien and Sonata. And so I'd say as a category, most antidepressants and sedatives are really tricky, and they can be dangerous to come off. People can get hurt. That's not to say antipsychotics and mood stabilizers are a walk in the park. They're not, but they don't seem to be causing as many problems as the sedatives and the blunting antidepressants. Stimulants generally tend to be really easy. Like if you need to come off like Adderall or Ritalin, you hardly need to taper them, if at all. I've never seen someone get hurt coming off a stimulant quickly. Wellbutrin tends to be easier. It's the only antidepressant that tends to be an easier taper because it's more stimulating. And so good rule of thumb is if a drug helps you sleep or if it mutes your emotions or suppresses your emotions or lessens anxiety, it's generally going to be a hard drug to come off because the opposite of that is awful. Insomnia, high anxiety, irritability. Like these are the things that drive people crazy.
Yeah. And hence why people need to have a fairly stable life before you're going to
Mhm.
work with them, right? Because this goes back to the foundational things that we were discussing in the
Yeah.
first place. So, what made you to get into this? Did you used to prescribe and then you saw the light? Like, how did you come to this place where you have the largest
Yeah.
tapering clinic in the
So
United States?
it just came from the fact that I had my eyes opened and I saw it wasn't working. I was in my psychiatry residency and I was hearing all of the propaganda like, well, these are serious medical conditions, the lifestyle stuff, it doesn't work. You need to treat them with drugs, to suggest otherwise is it's old fashioned and kind of stigmatizing. I'm just looking at the patients in front of me. No one ever took the time to understand their lives or their lifestyle or their relationship. No one was helping them
Yeah.
with any of that stuff. They make it seem like these people taking psychiatric drugs are getting all of this help and they've done all of these things and they're suffering from these mysterious, incurable brain diseases. But most of the time, they were just people just getting processed through a system, sold a lie. Even if I didn't have a problem with drugging away symptoms, although I do philosophically, I was just seeing that it didn't work. As I mentioned before, the drugs would wear off. Most people, after a year or two, would say, I don't even know what the drug's doing anymore, or it's only working 10% and it used to work a lot more. And they would just accumulate more medications and people would be getting worse. And so I remember thinking, this is not a sustainable way to help people. It doesn't make sense. And my professors were saying, don't worry, Josef, the evidence base supports this. These are approved by the FDA. And I just didn't buy it. And so after my residency, I decided I would focus on becoming an expert in the clinical trial research. And I did a fellowship at Janssen, which is the pharmaceutical branch of Johnson and Johnson, and I studied clinical trial design there, and then I worked at the FDA and then a few other pharmaceutical companies. And I got to see behind the scenes, and I just saw that we are practicing so far outside of what the evidence supports. I mean, there is no good evidence that these drugs work long term at all. And so when I saw that, and I also learned about all of the withdrawal issues, which I was becoming more aware of as I was researching side effects, I just had to call it quits. I'm like, I'm participating in one of the biggest frauds of the 21st century by being a mainstream psychiatrist right now. And the only thing that I could do to feel um, ethical in my career was to open a practice where I would actually help people exit this system.
Hmm. That's incredible. So, where are you currently? I know you're not in all 50
Yeah, so
states,
we're
correct?
in like the top 14 most populous US states.
Okay. Okay. Or do you have any goal of expanding to all?
I think
Or
eventually I would like to. We have There's so many amazing things that I want to do with the taper clinic first and get in place. I mean, my vision for the taper clinic is what I always wanted mental health care to be like. We have, so we're building out we have hiring a sleep coach so we can have a curriculum for good sleep. And then we also have classes that people can drop into, and they can work with a coach. We have a whole foods type nutrition plan for people, with also advice on elimination diets and ketogenic diets for select patients as well. So we're bringing on nutritionists, and we're going to have a curriculum, and also places where people can drop in and they can learn about nourishing their bodies. We're going to work on getting people there to teach people about moving their bodies. So, and eventually, relationships and all of these things. And so we're building a program right now to be a one-stop shop for what I just would want for anyone I loved, that they would be able to get help in all of these large domains that you really need for good mental health. And once we have perfected that model and it's working really well and we've ironed out all of the kinks, yeah, for sure, we're going to expand. We're going to try and make this available to as many people as possible, and just give people a better option out there than just drugs.
yeah, it's incredible the work you're doing. Where can people find you to learn more? I know your YouTube videos are incredible. I've binged them. So where is the best place for people
Sure.
to come find you?
A couple things. So yeah, the Dr. Josef YouTube channel is the main place on social media, and it's spelled Josef, not PH. But we're on all channels. If you want to see me arguing with people, the best place for that is X, and so I would go there. If you're interested in my practice, it's the taperclinic.com. Oh, sorry, not. It's just www.taperclinic.com. And so we help people there. If you're not in one of the states where we're working, if you go to the Contact Us section on the Taper Clinic website, I've listed 3 directories for doctors there who are knowledgeable about drug withdrawal and tapering, and they are practicing all over the world. So if you need that help, you can find those directories in the Contact Us section. And if you are a clinician and you are interested in learning how to deprescribe, we publish all of our internal trainings on how to deprescribe online free. I'm going to share it with Andrea. So we've got like a 5-hour course right now. It's what I use for my clinicians. And it goes through every single step that you would need to know in designing a drug taper and executing it. I'll just have Andrea share that with you in the show notes or an email later on.
That is incredible that you provide that
Hmm.
education for free. That really speaks to how much you want to change people's future and change the narrative, and because a lot of people would
Yeah.
charge money for that.
Oh,
You
yeah.
know what I
And
mean?
and the other way to get it as well is you can sign up to my newsletter through my website, and it's like it'll be on the first email that you get, and then you can unsubscribe if you don't want to hear from me, but the link is there.
Well, and we'll have all of this in
Hmm.
the show notes. And I'm really excited for this episode to air. I think it's going to be incredible and life changing for many people who listen. And I'm just so thankful to you and all of the work you're doing. It's not easy to go against the grain, and it takes a lot of conviction and being unpopular. And I'm just so thankful that you are really living into your mission and your purpose.
And I'm thankful for you and joining me out here, on the forefront and kind of banging the drum about how bad things are, because
Yes.
that's what people need to hear about. Yeah.
Absolutely. Absolutely. It's my pleasure. I'm happy to spread the word. Thank you so much for your work. And I really want to encourage anybody listening. This is such an imperative episode to share, to spread the word, educate your friends and family, and get people in contact with really excellent resources that are going to be so supportive for them. So thank you for tuning in, and we'll see you in the next episode.